people of the state of Tennessee are in opposition to this health bill. Is that is that true? Do you find it to be true in terms of your own practice?
Well, I think that people are concerned about how much it's going to cost. And again, I mean, when you spend money now, it comes out of your pocket now, and it's hard for people to understand that if you spend a little bit now, you'll save a lot at the end. So I think that's been an issue, I think.
Very good. But you think that is a way to go in terms of what we should do about health, that prevention should play a very, very important part in it?
Well, I think medicine now is concentrating so much on technology and extensive therapy and drugs and CT scans and this and that. I think if we use that in conjunction with spending more money on prevention and screening, we would cut down the risk of cancer, cut down the stage of cancer, cut down the difficulty of treating it, and make money much more effective, I think.
Now, the Meharry Medical College is a traditionally historical black institution. Now, what has the new health program done in terms of helping Meharry meet some of the challenges that it has had to face over the last many, many years, even before it became part of General?
Well, I think the difficulty is that the patients that we see, many of them are what we call underserved. Those are patients who have just never thought about health care, don't practice good health care. I think the current healthcare system is emphasizing that.
And of course, it will have a tremendous impact in terms of, I think you also mentioned that you've received grants. Is that part of the healthcare money that's coming to Meharry Medical College?
Well, actually, we're a special institution. We actually had to apply for it especially for us. And we said, this is what we want to do. These are our resources. This is what we want to accomplish. And we've gotten funding to do that. So let me give you an example. We now have what's called a survivorship clinic. So patients have as much difficulty after therapy concludes as during therapy. They have all issues of anxiety and fear. And we have a special office hour and specially trained nurse practitioner that deals with the patient's issues after therapy is over. And there's only one other institution in Davidson County that has that type of clinic.
I would imagine, Ms. Weatherspoon, that's the kind of work that you do in terms of dealing with these individuals.
Yeah, but I work more on the surgery aspect of it, too.
Now, what do you do in terms of the surgery of it?
I first assist. I work with a surgical oncologist, Dr. Beach. He's our chief of surgery, and I help him in the surgeries.
And so I think you're noted as a PC-C. Now, what does that mean?
A PA-C. Yeah, it means certified physician assistant.
And so you are certified to be in the surgical room dealing with whatever Dr. Wolf is dealing with, and et cetera. Very good, and that's a very, very important situation, is it not, for her, Dr. Wolf?
Well, I think that Beverly is a good example of the resources that we have. We have a full complement of physicians, nurses, nurse practitioners, physician assistants, specially trained individuals. We have a special cancer pharmacist that just gives out chemotherapy. So I think what people think is not true. We have a full complement of dedicated resources at the National General Hospital.
Very good, and it covers all all areas. Is that
all forms of cancer? We see everything and we take care of everything.
Okay, Doctor, I think we've got about a minute. Let's give you an opportunity to make a statement before we end, and of course end with Dr. Wolf here.
Okay. Well, every year National General Hospital's Breast Center has a program called Mammograms in May, and it's for women 40 and over. It covers a screening mammogram. It's no cost to the patient. Starting May 2nd, Monday, May 2nd, patients can start calling a hotline. The number is 341-4447, and it's for women to get their mammogram. And if you do have insurance, it'll cover the copay as well. And it's also, another guideline is if you haven't had your screening mammogram within 12 months, you can apply for that program.
Very good, and of course, over the last 20 seconds here, Dr. Wolf, let me apologize for calling you somebody else, and let me apologize for the stall that we had this morning, but we certainly appreciate the two of you coming by and giving us that excellent information. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you, and good night.